Basically, what we had in this study, they try to use a cardioprotective drug to minimize the effects of doxorubicin as chemotherapy on patients receiving chemotherapy for tumors, and minimize the possibility of cardiac failure afterwards. And the specific mechanism of this drug is actually not known what it is. Some people think it scavenges free radicals, or they also, it scavenges some iron on the cell, and then they think that limits the amount of apoptosis, which is programmed cellular death of the heart. The study in itself, it's somewhat limited by the population that they use and the amount of patients that they have, but they basically shown that it's a safe drug to be used, and it's very promising as far as limiting the amount of cardiac failure that you see afterwards. If you're planning to use high dose of this medication, then you should consider this drug. We still don't know what the mechanism of action is. We still don't know exactly what it does, but it's something that we have in our armamentarium of medication to use to avoid heart failure. I'm not sure if it's enough evidence on one single study to change our practice. What I think it needs to happen is we need to have a bigger group of patients, multi-center trials, bigger than exactly what we have done on this study, and potentially more different types of chemotherapy and different types of cancer to see a broader population, a broader effect. That's what I think. But I think it's promising, and I think it's something that I would definitely consider if using higher doses of doxorubicin. So basically, one of the things that we won't know is that we're very limited on the amount of long-term follow-up for this drug, and we know that kids can develop heart failure, cardiotoxicity, 20, 30 years from the time of administration. So given that this drug is new, we would like to know exactly what this drug would do as far as protection 20, 30 years from now.